Our mission is to provide a reliably pet retail shop environment while ensuring the best possible care for the variety of pets. In order to fulfill our mission statement, we need to suggest practical recommendations to the pet shop owner, and we are very keen to do that in this pocketbook. This pocketbook is designed for anyone who needs information and suggestion on how to make a pet store a safer place to work. And what is pet shop? Pet shop is a pet store that sells animals such as cat, dog, rabbit, fish, bird, and hamster, and also sell variety animal supplies and pet accessories to the community. And here are some job scopes of the workers in the pet shop. They have to keep store, aquarium, and animal cages in clean, answer the questions and offer animal care advice to the customers, look after health of all the pets, meaning that they have to make sure all the pets are in the good health condition, and have to stock the shelves and order animal products from the distributor. Based on the job scope mentioned just now, the workers have potential health risks in the daily routine at the workplace, such as animal allergens, respiratory problems, pesticide exposure, dermatologic conditions, animal bites and scratches, and also infectious disease.
Generally, all workplace or store can be associated with various types of hazards. At pet shop, workers are exposed to chemical, biological, and ergonomic hazard. Chemical hazard is a non-biological substance that threatens employees when exposed to dangerous liquid handle. Biological hazard refers to a biological substance that poses threat and extremely dangerous, whereas for ergonomic hazard is a factor in workplace or environment that cause damage to the human musculoskeletal system.
From the hazard identified previously, hierarchy table is constructed based on the commonly or routine activities in pet shops such as pets handling, hygienic care and routine, provide aesthetic service and handling pet store product. The potential hazard for pets handling is intoxication, which can cause respiratory problem. Next one is infection, which can cause severe diarrhea and headache. And the last one is repetitive and awkward posture, which can cause lower back injuries, arms and hands discomfort.
Risk analysis is a part of hierarchy table. From the activities that were identified previously, it is ranked according to its likelihood and severity. And from the table, we can see that pets handling, hygienic care and routine score medium risk level, which indicates it should be taken into consideration in comparison to the other activity. In risk control, the mentioned activity will be given a recommended control measure that will be further explained in the next section. But generally, the recommended control measure would be use personal protective equipment, PPE, frequent hand wash with water and soap, and reposition work table to encourage neutral movement and posture. In this section, each hazard measure will be further elaborated. The first one is intoxication due to chemicals. Pet shop deals with numerous types of chemicals such as pesticide, solvent, strong acid and alkali, and detergent in order to fulfill their job requirement. The absorption of these toxic chemical agents will bring multitudes of illness. Besides, dermatologic concern and allergies are considered as chemical hazard. As for biological hazard, is acute health effect caused by flea control product by animal handler. Flea control products are products that are often handled by pet shop workers to control and eliminate flea from the pets such as dogs and cats. The toxicity from this product can cause diarrhea, vomiting and other conditions. The next one is exposure to airborne pathogen, which result in development of communicable disease are associated with biological hazard. Ergonomic hazard is associated with the risk factor, which include awkward posture, repetition, duration of exposure, and material handling. Pet shop workers often spend many hours at workstation may develop ergonomic related problem resulting in musculoskeletal disorder such as terrible back pain.
Now, moving on to the control measure of all type of hazard in the pet shop. So here are the strategies to reduce the risk of chemical hazard. The first one is the substitution. Use lower toxicity of pesticide and minimizing the amount of pets exposure to it during and after application. And if this step is not sufficient and effective to reduce the hazard, we move on to the next step which is the isolation. To minimize the risk of harm to pet, we need to isolate and remove pets from any area that you plan to treat with pesticide. Next, restrict access to the area by limiting number of workers. Next is the engineering control. We need to ensure that there is good ventilation system for airflow inside the pet shop. For example, open all the windows to allow natural airflow going inside the area to reduce the concentration of the chemical in the air. Next is the administration. The management have to create an operational procedure that restrict access to the chemical vents and also install required physical barriers such as keypad, locked doors to keep unauthorized people out from the restricted area. And lastly is the PPE. All the workers who are exposed to the chemical or handling the chemical need to wear the disposal outerwear, gloves, protective eyewear and also respiratory protection. Now, moving on to the biological hazard. The first one, elimination. We need to use pesticide to eliminate the biohazard agents such as the pest species. And of course, we need to use the low toxicity of pesticide. Next, take away infected animal out from the group to stop the spreading of the disease to other pets and also the workers. Next one is the isolation. We need to isolate infected pets in the quarantine room or send them to the veterinary as soon as possible. The third one is the engineering control. The workers have to do the regular cleaning and it is suggested to use the HEPA, which is the high efficiency particulate absolute vacuums, because HEPA is incredibly effective at capturing almost every size particulate of airborne. Next is the administration. The management have to provide pre-exposure rabies vaccination for the workers with direct animals contact, and only workers who have completed the vaccination series should work with dogs and cats or other mammals, or else they will expose to the risk of hazard. Next, the management have to provide the medical surveillance system. And lastly is the PPE. All the workers who handling the pets should wear the respiratory protection, wearing lab coat and also moisturizer impermeable glove when the scratch hazard is present. They also need to use the mucous membrane protection or also shoe covering. And lastly, the ergonomic hazard. The first one is the engineering control. They need to redesign the workstation to eliminate the awkward position and also provide adjustable table and chairs that allow the natural posture. They also need to provide the cart for transporting the stock. Second one is the administration, and the management have to improve the work policies and procedures. They need to require that the heavy loads are lifted by 2 people to limit the forced exertion, and also provide training on the safe working postures and lifting techniques. And lastly is the PPE. All the workers need to wear knee pad for kneeling tasks and use shoulder pad to cushion loads when they carry loads on their shoulder. And lastly, they need to wear gloves when they are carrying the rough object.